Good evening. I am Lena Ellis, the second Vice President and Chair of our Program Planning and Development Committee. I will be providing technical assistance with my team tonight during our meeting. I would like to let everyone know that you are currently in listen-only mode. Throughout tonight's presentation, if you have any questions, please type your questions in our questions and answers box or the chat menu, and our panelists will do their best to answer the questions at this time. On behalf of our chapter president, Jackie Smith, thank you for joining us this evening. We will now begin our program.
Good evening. Welcome to a critical discussion on suicide in Black males. What's happening to the men we love? My name is Tanera Matthews. I am the Mental Health Awareness Team Lead under the Physical and Mental Health Subcommittee of PP&D for the Suburban Houston Fort Bend Alumnae Chapter of Delta Sigma Theta Sorority Incorporated. May is Mental Health Month. Taking care of our mental health has been strongly advocated by Delta Sigma Theta Sorority Incorporated since the advent of the pandemic. With COVID cases in flux, in-person graduations on and then off, the pleasure or pain in working from home, and the uncertainty of whether to wear a mask may have felt a pull on mental wellness. Systemic racism and historical barriers and inequalities have left particular ethnic and racial and minoritized populations facing trauma, loss, bias, social disparities, and other unique challenges that have gone unsupported and largely unaddressed throughout this pandemic. Today, we will focus on destigmatizing mental health treatment for Black men and boys in an engaging manner, using psychological science focus. We hope you enjoy our thoughtful discussions with our panelists. And I'll now turn our program over to our three panelists to introduce themselves. If we could begin with the lead panelist, Dr. Napoleon Higgins, followed by Dr. Otis Anderson III, and then Dr. Kareem Salam. Gentlemen, you have the floor.
Thank you so much, Tanera. My name is Dr. Napoleon Higgins. I am actually from the Houston area. It is great to be requested to be a part of this with the Delta Sigma Theta Alumni Chapter in Fort Bend County. I am a Fort Bend County product. I went to Willow Ridge High School, lived in Briargate, Briarville, Hunters Glen 3. So I'm part of that old part of Missouri City. Out that way. So it's great to be on with you all today. I have a private practice, Bay Point Behavioral Health Services, and then also do some research with clinical trials. I went to Meharry Medical College in Nashville, Tennessee, the only time that I was outside of the Houston area or even lived above I-10 my entire life. So I've been in this area for a while. For my entire life, I do want to mention that I work with this group of men that we're talking with today, which is part of our team of Global Health Psychiatry. So I will let Dr. Otis Anderson go next in introducing himself.
Good afternoon, everybody. I'm Dr. Otis Anderson III. I'm originally from Memphis, Tennessee. I'm child psychiatry trained, as I formerly served in many capacities throughout the deep poverty of Mississippi. As I formerly had a outpatient clinic, but also served as medical director for chemical dependency units, as well as a country provider for the Mississippi State prison system, where I served 5 of the 7 prisons and served pretty much 60% of the inmates' needs across the state. As a former SAMHSA fellow, I strongly believe in providing care for underserved communities. My joy now is actually trying to expand services, as I have been working in my nonprofit stages, as I'm currently the chairman of the board for the Day Academy Network, which provides postgraduate basketball and academic training for kids ages of 15 to 24. I'm thankful and I'm glad to pat myself on the back. We provided college opportunities for over 120 kids in the last 7 years. We really appreciate being here today. I am the one panelist who's actually married to a Delta. The next is Dr. Salam.
Good evening, everyone. My name is Dr. Kareem Latif Salam. I am not located in Texas. I'm in the city of brotherly love and sisterly affection, more commonly referred to as Philadelphia. It's a delight to be here with the women of Delta Sigma Theta of the greater Houston area and Fort Bend County. As Dr. Higgins mentioned, Doctors Anderson, myself and Dr. Higgins were all founding members of Global Health Psychiatry. I'm a board certified adult and child adolescent psychiatrist on faculty at Drexel University College of Medicine in Philadelphia. I'm the medical director of an adolescent unit in Northeast Philadelphia, caring for youngsters who are in crisis, 13 to 17 years old. And our collective passion is bringing mental health awareness to the community. Doctors Higgins, Anderson, and myself, we grew up together as psychiatrists, as residents and fellows, and we decided to marshal our resources to form Global Health Psychiatry to really eliminate the middle person and deliver the information to the people to address stigma and the crisis associated with mental health in communities of color, with a specific focus on the Black community. So it's an absolute delight to share time with you on this critical topic of suicide among African-American men. Thank you so much.
Well, this is Global Health Psychiatry. We were originally founded with 10 Black psychiatrists who wanted to deal with the issues of mental health in our community. We wanted a way in which we could connect with the community that is not being done in traditional ways. So we wrote 3 books here: Mind Matters, A Resource Guide to Psychiatry for Black Communities, which talks about mental health, mental illness, and it goes through all the major mental health diagnoses in question and answer format. So we didn't want to have a paternalistic behavior in telling people what they wanted to know. We took the questions that people have for us and we answered it back in the book. But what is unique about this book, we answer it back as if we're talking to our grandmother. Meemaw, Big Mama, Nene, whatever you may call her. So when the information comes out, it's actually spoken on a 6th grade level. So we talk about mental health on a 6th grade level, which makes mental health sound very different and very common. So this is a resource guide to our community about mental health. We have 2 other books, Bree's Journey to Joy, which is written during the COVID-19 pandemic, dealing with childhood grief and depression, realizing that children are having a lot of losses right now, not only of loved ones, but this in and out of school, and school is canceled and not being around friends, the social isolation that comes with the pandemic and not being able to go places and do the things we normally do. And then our other book, a child book, is How Amari Learned to Love School Again, a story about ADHD, which goes through the story of a young man who struggles in school, and we're trying to get him to the point where he does well again. So how he enjoys school. So those are some of the products that we have with Global Health Psychiatry. And this is the work that we do, communicating to the people. So if you want to find the books, you can find it on Amazon, and this is our social media. So at GH Psychiatry on Facebook and Instagram, as well as, and I forgot to include LinkedIn. This is our email address. And please go to our website to see, we do corporate training. We do a lot of different services, training, curriculum. We have 2 curriculums for children, one on school violence and another one on dealing with issues in the pandemic. So we are a very active group who loves to engage the community, and we appreciate the ability to be requested to be here today. I do want to thank on the front end Tanera Matthews, who we've worked together in mental health before, and I appreciate you giving me a call. And then to my classmate Tracy Jackson, Tracy Davis. You know, I don't want to be disrespectful of the other names that you've acquired and letters behind your name that you've acquired since we went to high school together. But it's great to see you. Tracy was was on the was a majorette. I was in the band. I've been knowing these people for a long time. So it's great to be with Fort Bend DST and the work that you all do. So understand this quote by Robin Williams: everyone is fighting a battle you know nothing about. So understand that we all carry our mask. We all have something going on. Everybody has something popping in their life. So despite our nice clothes and our money that we make, and we, you know, the backgrounds that you see behind many of us in our homes, we all have something going on. And I tell individuals, in order to take care of your mental health, you've got to be intentional about it. So understand this: suicide rates are up. Suicide are among the top 10 causes of death amongst all age groups, all right? It costs billions of dollars of lost productivity when you lose someone in their life and the things that they were contributing to our love and our family and our homes, but also the cost of issues of depression and mental health. It costs billions of dollars of lost productivity, and that mental health impacts the individual, it impacts the family, it impacts everyone around them and society as a whole. Historically, suicides have been higher among whites, but we find that across all age groups, Blacks are increasingly killing themselves at higher and higher rates, that in moving towards the suicide rates of whites, in that it's a growing trend, except for white youths. And when I mention the word youths, I'm referring to the ages of 5 to 12 years of age, in that we're actually seeing the issue of suicide impact young children at as early as the age of 5, realizing that firearms contribute to half of all completed suicides. And you know, when we look at that, I just tell people that I know we're in Texas, I know we're in Fort Bend County, there's a whole lot of guns around. And I tell individuals this: beware and be understanding that a firearm in your home does increase the risk that someone in the home will actually kill themselves, and that there are 123 suicides per day in the US. And during the pandemic, these numbers are going up, in that the stress of it all is truly wearing us down. So we look at the pressures on Black men, all right? And the issue of wanting to be successful. Every man wants to take care of the people that they love. They want to take care of, as a child, you want your mama to do well, you want your sister to do well, you want grandma to do well, you want auntie and everyone, all of these women and loved ones and men in our lives, we want to be successful so that we can provide security for our homes and families. And with that, we want to earn enough money, and our identity is often tied to the work that we do and how much money we make and what we're able to provide for the loved ones and the people that we care about. And that we have the responsibilities, you know, I know for myself, of raising children and having a family and taking care of my wife, the work responsibilities, and then the home responsibilities, to be an active partner, to be an active father, to be an active husband, to be an active lover. We want to do all of those things and give our family and lay the world at the feet of the people that we love. And then we have this pressure to stay successful. Life has its ups and downs. And when we're not able to provide or the family suffers, we take it personally as men. As you know, is that, you know, something financially has happened. We're having difficulty paying the house note, or even as a young man. All right. My parents got divorced when I was very young. And that was a level of responsibility that genetically, in the genetic code, that I've got to make sure that I take care of my sister, that I take care of my mother. And some people would call that toxic masculinity, that a 5-year-old would find the need that he feels that he should be responsible for people having joy and happiness in their home. And I will say that I know from my father, who was outside of the home, but was always present. So when my parents were divorced, my father was present. I took that from his example, that I need to be there for my family and for the home, and I need to take care of or try to help with whatever problem is going on within the family. So this issue to be successful and to move the family forward is something that, oddly enough, even young men, children, find the need for this at a very young age. But then there's barriers to medical treatment when it comes to men. We're less likely to engage in the medical model overall. All right. Obviously, for young women, there's an age when they start their cycles. So at that point, they're engaged in the medical model. They have to go and see someone. Obviously, we saw people as we were babies, and then we, teenage years, early adolescence for women. I've met men who've only seen a doctor one time. They had to get a physical when they played 7th grade B team basketball. Now you're 40-something years of age and you have not gone back to the doctor because you feel like nothing was wrong. So too often we don't engage in the medical model. We're less likely to reach out and share our pain. We're taught as men that we're strong, don't let it bother you. You can't show any pain. And so we're less likely to reach out, and then we self-medicate with alcohol, drugs, overworking ourselves. Sometimes you're acting out with, sexual decisions and sexual behaviors, trying to prove that you're a man when you have losses in other spots and places in your life. So we're very good at masking the pain. And I would say as Black men and as Black people, we mask the pain all the time. We deal with all these pressures coming from different areas, and we want to show that we're strong, that we've got a handle on things, that often the world is doing things that we don't have a handle on. But we want to show that strong face in front of our families and not have them to be worried about what's going on, even though we cannot control everything in the environment. So this lifetime of trauma, when we look at the young men, so far as school and being discriminated against in the school, as we talked about this murderer who killed 10 Black people simply because they were Black and 200 miles away, you got to realize people go to school with that kid. All right. And for every one of him who killed somebody, there's another 10, 100,000 who don't like Black people. And when we look at the Little Rock 9 and integration of school that happened just in the 60s, that was realized that was with our parents. I remember they integrated Missouri City Junior High, the elementary schools in Fort Bend while we were there. All right. So the issue is, just like there are people yelling outside the buildings in the 1960s at these children, when they walk past those people yelling and throwing things at them, they walked into a school with people from the community. All right. So the building of the school did not necessarily protect anyone from the vile issue of racism that occurs actually in the schools as well. And then, you're less likely to be promoted for advancement. There is actual numbers that show that you have to be twice as good to get half as far. And that when it comes to Black children, they have to score in the 95th percentile to be recommended for advanced placement in high school, versus when it comes to whites and Asians, they average about the 40th or 50th percentile. So they only have to be average to be recommended, when we have to be the pinnacle to be recommended for advancement in classes, which then sets up your life as early as middle school and high school for where you will be and what kind of jobs and education are going to be opportune to you as an individual. So many will see that they're being punished throughout their life, and that even if a child, they may not be able to say what it is, but they know wrong. All right. They know when it's wrong. They know when it's not right. And they know when they're being treated differently. And then the set of confusion of what's wrong with me for being who I am. All right. And then as we are men, the financial hardships. Black men go to college and we get hired at a rate so far as being early management at the same rate as a white male who has a felony conviction. So this does not stop. All right. This issue of racism, being not paid as well for the same jobs, knowing that we're not getting paid as much, but the fact is that we have to take care of our families. And so, we can't just walk in and start cursing people out and be like, give me another 30% more. So masking this pain and then the issues of these aggressions and microaggressions on the job. And then we come home to our friends, we come home to our wife, they ask how the day was. And so often we will lie because we don't want to show the pain. And we don't want to show the abuse that we have to take on the job as men to our families. So this continual changing roles also is impacting men. So far as with Black men, especially Black women on average are making more money. All right. This is now a shift that we're seeing more women making more money than the men in their lives. We are less likely to be educated as Black women. And then finding our place and our role is something that we don't talk about openly. But I remember my grandfather had a conversation with me 30 years ago, where he said things are going to be very different for you and your generation, and that as a young man, a young woman had to marry a young man in order to get out of the parents' house. But the fact is that with you all's generation, the women don't need you all. And if she chooses not to marry you, she may not, because she does not feel like she needs you. But also the other side of that is, you could be married and she may decide that she doesn't want you then. But the fact is that he was saying that as he was a young man and the abuses that they did, the equalizer has been education and money, and that women don't have to take what they were dishing out at that time. And that was good for him, for his daughters. All right. So these things of these changing roles and men finding their place, and that you have, women say, I don't need a man. I don't need a man to protect me. I don't need a man in my house. I don't need a man's money. So the question, in a young man's mind, if they've been hearing this their entire lives, then what is my place inside the family and inside the home? And of course, there's plenty of places inside the family and home. But if you listen to the dialogue and the information, it's causing our men to question, then what do I do? And where's my role now? So we look at these rising rates, the rising rates of suicide of Black children, all right? And the highest increase of all youth of Black children is in males, the highest rate of suicides, all right? So even though Black youth, when we're talking of 5 to 12 years of age, are only 15% of the population, this is odd to know that suicides of Black children are actually outpacing suicides of white children. So despite being 15% of the population, they're actually outpacing that of white children, and that 5 to 12-year-olds have double the rate of white children. And we see this trend in numbers that have gone on since the 90s. David Satcher, Dr. David Satcher's former Surgeon General, Black Surgeon General, I believe it was under Clinton, clearly showed and talked about we have a rising rate of death amongst our children from the issue of from 1980 up to now, and we see the numbers even further increasing. Next slide. So this is the work by David Satcher, which showed the increase of deaths since 1980, and that suicide rates amongst Black children from 1980 to 1995 increased to 233% for 10 to 14-year-olds. But then we look at current rates right now. Black adolescent teenagers have had 182% increase rate, and then Black males at 60%. So this is very odd. We see these numbers going up amongst all Black people in our children. Black youths, the boys are outpacing, and then in Black teenagers, it's the girls who are outpacing, but all numbers are going up very fast, and even worse during this year's pandemic. Contributing factors. Part of the issue when it comes to receiving mental health is the lack of access to mental health, all right? Too often we're not intentional about getting our children in to see someone for their mental health issues. We have the issue of racism and racial discrimination, all right? Our boys and girls understand when this is going on. Like, why am I not being chosen? Why am I always a problem? Why is the teacher always looking at me? Why am I being followed inside the store? We see an 18-year-old from a high school go out and shoot a bunch of Black people just for being Black. The social media, comparing our lives to other people. I tell people this, when you look at my social media, that is not my life, all right? That is my metaverse life. That is Dr. Higgins in metaverse. You're looking at the highlight reels. That's like looking at SportsCenter and thinking every play is a dunk, all right? There's a whole game going on. But also the issue of bullying and teasing, where people can jump on you who don't even know you. People can spread lies and rumors and misinformation. You get into a fight and, it used to be only the 10 people on the bus who saw it. But now you have a fight on the bus on the way to school and 1,000 people have seen the fight by the time you get to lunch at 10:30 or 10:45. So you have these bullying and teasing that's on a whole nother level. Families are busy. Parents are working. We have to bring our work home, and we're not able to spend the time that we would normally do. Social media. A lot of times mama's on the phone. All right. Daddy is doing whatever he's doing, talking to his boys and looking at the, making jokes and all these other kind of things that are pulling us away from our families. Too often we're not sitting at the table and eating dinner with our family. I can guarantee you, if I hear a family say that me and my kids don't speak, that tells me that you and your kids do not eat dinner together or do not eat meals together, because people speak in their communal when they're breaking bread. The single parent home issue, the issue of poverty, and a lot of it is very uncommon for two people who are working, who are living together, to be in poverty. All right. They may be broke. They may not have a lot of money, but two incomes coming together inside of a home, income disparities between men and women, especially on the lower end of the spectrum on these essential worker type jobs, can show a lot of disparities. And that even is exacerbated when women in those areas may be making less than men doing the same jobs. We have an issue of other contributions to Black suicide amongst men. We looked at boys, but the lack of culturally relevant providers, somebody who understands me. We have the issue of, the Tuskegee experiment and health disparities, but realizing that our mistrust of the medical system and healthcare system and mental health system is based upon real stuff. We do get treated differently when we go to the doctor. We're more likely to be sick. We're more likely to end up in a hospital, and we're more likely to die than our counterparts who are white. So we need to make sure that we have more mental health providers. We need to put mental health education into what we do. All right. Too often people are seeing me on the back end after something has gone wrong. I'm seeing the grandfather after he attempted suicide. Well, we need to put mental health education into schools, and we need to talk about it, because it has to be an intentional act for people to understand what is going on with their mental health. Trauma in the family. All right. Whatever happens inside the house happens to the kid. So if mom and dad are yelling, mom and dad are yelling in the house, and the children hear that. And it's painful and it hurts, because I'm half a mom and I'm half a dad. And when one talks about the other, I hurt on both sides. All right. So how our kids do have a lot to do with how we do. So if that was a fight, verbal, physical, that happens in our community, that happens in our home, and it happens to the child. Also look at the trauma of violence and loss. We have a lot of deaths in the Black community. I grew up in the Sunnyside area, South Acres. On that street, as a young man growing up, the drug game hit very hard in the 1980s and early 90s. And this sounds crazy, but within 5 years of my age, be it above and below, every Black male on that street is either dead or incarcerated. Every last one of them in a 10-year span. And honestly, I was sitting around waiting on when do I go to jail? Because everybody around me was getting caught up in so many different ways and how policing is done in the Black community. And then, so we have the trauma and the violence, but also we don't talk enough about sexual trauma. Understanding that for every 4 girls who are sexually abused or molested or raped before the age of 18, there are 3 boys as well. So we have to look at the safety of our children and make sure that we pay close attention to it. We have to go and look at the issue of perceived racism and then the access to firearms. If your young man in your family owns a gun, he's the most likely person he is to kill with that particular firearm is himself. That is the most likely person you ought to kill with your gun. All right. So we have to make sure that we have understanding, especially of safety when it comes to firearms inside the home, realizing that over half of deaths suicides that men do are them shooting themselves with their own gun. So we need access to care. Understanding that issues deciding on care regarding Medicaid, Medicare, when we vote on people who are going to make decisions about our health care. We have to look at stigma, lack of awareness, fear of the medical model, and we go see everybody before we see the doctor. We talk to our boy, we go to the barbershop, we talk to the pastor, we talk to our whoever, we talk to our mama before we actually go to receive mental health care, and that it can be seen as lazy or being weak. But I tell people this, there are more psychiatrists than OBGYNs. More psychiatrists than OBGYNs. Half the population, over half, will say they go to see an OBGYN. But no one talks about often in the Black community want to see a psychiatrist. We've got to change that and change the narrative to let people know that this is where you want to start your health care at. So when we look at changes that are needed in the system, education, health, housing and living in a safe place, the economics of our community and our finances, the legal system not being caught up in the legal system because of your mental health, the environment is important, clean water, safe places, clean air, media, social discourse, and of course, we've got to change how we deliver healthcare. So let's get to some questions and answers about the presentation, but also we want to answer any question that you have about suicide and Black men, mental health. I know that we have the ladies of DST, and I see a few brothers on here as well. Let's go through some of these deep questions. Whatever's on your mind is a time. This is the time. If you've got the question, this is the time that you have 3 docs. You've got me, Dr. Kareem Salam, Dr. Otis Anderson. We're throughout the country. We work specifically with the Black community and with Black families and Black men. So please fire away at whatever questions you may have.
Thank you, panelists, for your expertise and great discussion. We do have one question. Any thoughts on how we improve mental health for the Black community?
Absolutely. Number one, thank you, Dr. Higgins, for the enriching and informative presentation. That's an excellent question. How do we improve mental health in the Black community? I think we start with what we're doing tonight and exchanging information, attacking stigma. And if you feel more comfortable with having these conversations with folks in communities of color and with Black professionals, you should seek those professionals. So opening your mind to the conversation is number one, because you know what you get when you remain silent. These are very important issues in the life of a Black man, should not be relegated to hoping, wishing, or praying that they remain safe. So most of the women who have Black men in their lives, whether they're their husbands, their sons, their nephews, their neighbors, you notice when something is wrong, when there's a change. And the worst thing you could do is ignore that and hope it or wish it away. So it should be interrogated gently and directly. And the wisest among women are the women who recruit men to extract information from men. So if he's just giving you the single word answer, then you need to holler at his boy, at his friend, at whoever's part of his village and say, I think something's going on, and really deploy him to engage with this young man or with this man, and in a sense, be your operative so you can get valuable information and you could help this man in whom you've observed a change.
Thank you for that. We have a couple more questions. Where can you receive resources for diagnosis?
Look at Dr. Higgins' background and the book that's right above my head. Mind Matters, a resource guide to psychiatry for Black communities. And as Dr. Higgins mentioned, it's written in question and answer format, and our avatar was a Black grandmother. So you could start right there. It's a distillation and a collection of the major mental health disorders, really breaking it down for the people, not hiding behind fancy medical jargon and terminology. So you could definitely start there. There are other places, NAMI, National Alliance of Mental Illness, and then there are useful websites if you're seeking Black providers. So therapyforblackgirls.com, therapyforblackmen.com, and the psychologytoday.com, where they have profiles and headshots, and you could tell they have whether or not someone's a person of color. It's very, very effective tools.
And one thing I do want to add is that Dr. Kareem Salam, and I see a question here about medications and safety of medications in Black people. Dr. Kareem Salam actually in the book wrote the chapter on medications. So we go through what psychiatric medications are, what they do, how they work. Another chapter in the appendix of that book is what to expect during a psychiatric interview. What are the questions that the doctor is going to ask you? And what are they looking for? So too often we don't go in, we don't receive the help that we need simply because we fear what is going to happen in the interview, because we can be clueless of what is this person going to do. So the point is, you know, in the book, we do actually cover that information, those basics of what is mental health. The first thing is, what does a psychiatrist do? All right, that is actually the first question that we have in there. So we want to make sure that people access the resources. Psychology Today, therapy, you can do a Google search. And also I do want to add, I'm gonna put another hat here. The Black Psychiatrists of America is working on an actual nationwide resource. We're calling it, you know, colloquially the Black Psychiatry Green Book on where to find a safe space to talk about your mental health. So we're working on that as we go right now. We got several hundred names and we're expanding it as we speak.
Thank you for that. Any thoughts on high-profile celebrity deaths?
I guess in the sports and entertainment realm, you have to think about the fact that they are impervious from stress and trauma. They are impervious from being vulnerable. The issue that you're going to have, especially when you're talking about Black men, is helping them to find a safe space to be able to adequately evoke how they're feeling. The issue that you're going to have at times is, and even for myself, you know, I'm 6'6", 300+ pounds. For me to actually tell you how I feel, it automatically puts people on the defensive. And so if I feel like it's necessary for me to speak up for myself, you oftentimes feel like it's hard for people to automatically assume that you're abrasive and that you're violent. And as these guys will tell you, I'm probably the nicest, easy-go-lucky persons that they've come across at times. The issue that you're going to have with sports and entertainment, especially the celebrities that have passed away, is oftentimes they're hiding how they feel. And so it's very important that, you know, we put in the process, just asking a Black man, how do you feel today? You know, and asking in an intimate setting to where he'll feel comfortable enough to tell you how he feels. And don't rush to judge him for telling you exactly how he feels.
We have another really good question. In what ways can you help or provide support to someone who has attempted suicide?
Well, you know, the thing is that we've got to access, you know, mental health services. So if there's a suicide attempt, you know, obviously this person is hurting, they're in pain. Understand that mental health is treatable. It's treatable. 80–90% of the time, if you're feeling some type of way that's impairing your life, a mental health provider, be a psychiatrist, psychologist, therapist, counselor, there are multiple ways to access mental health services, can help you through that. You know, sometimes you may need a social worker. Sometimes you may need a lawyer. You know, all of these things go into the overall contribution of what's going on with an individual. But if you've attempted suicide, you're in a serious medical situation that we need to provide safety for, all right? But also, you know, we've got to be intentional in receiving care and treatment, trying to prevent that from occurring again. So essentially, you know, for a person to do an attempt to end their life, we've got to understand that this person is in a lot of pain. They're in a lot of hurt. And we've got to be intentional in understanding that it's not a character flaw, it's an illness that can receive help. This is something that we can actually help. That too often I hear people say that, you got to pull yourself up by the bootstraps. None of us walk this situation alone. How do I pull up myself up by the bootstraps if I have no arms, my arms are too heavy to lift? My back is hurting too much when I bend over. And so therefore we require that help from other individuals, from professionals. And we want to be intentional and aggressive. This is not a passive thing when it comes to your mental health. We've got to be on it, especially if we've seen an issue of a suicide attempt.
I'd like to add to that quickly. The best predictor of current and future behavior is past behavior. So if someone had a failed suicide attempt, just like someone who had a stroke or a mini stroke, they're at risk for the big one. So in describing different types of doctors, surgeons do with their hands, internists think, and psychiatrists, we listen. So it's important to listen, especially if someone has a history of dangerousness. And finally, a practical tip: if someone is in need of mental health treatment, care, intervention, and they need to be seen by a professional, and you're a true friend and loved one, offer to accompany them to the intake appointment, to the first appointment. That could really, really be helpful.
I think the issue with suicide is that people that have had previous attempts, they have to have a pathway to validation. They have to feel like that they are seen, that they are heard, that they are loved at times. The issue that you're going to have, the crux of the matter, is the fact that they get to a point where they feel utterly hopeless and helpless, and they actually feel unworthy of living. And so with them having a necessity of hope, a pathway to happiness and joy, these things can kind of help to kind of overcome some of those desperate and disparate feelings that they may go through at times.
Thank you. It looks like we have time for one more question, but please feel free to reach out to our panelists for additional dialogue if needed. So our last question is, have you been successful with collaborating with local parishioners regarding mental health in our Black community?
Really quickly, in the greater Philadelphia area, as part of my work with global health psychiatry and as a practicing Muslim, I've engaged with different mosques, particularly those in the African-American Muslim community. And these efforts have been recognized. And interestingly enough, the award I received for this work was in the great city of Houston. The work was not done in Houston, but the convention was in Houston where I received the award. And again, like, the wisest women are those who recruit men to serve as messengers for the important men in their lives if they want high quality information. The wisest clergy are those who know their lane, they stay in it, and they realize that, hey, this is a situation that might be beyond my ken, and they will call in a professional.
And I'll add that just on the call before the call jumping on here, I was on a call with the Baptist Ministers Association of Houston and greater vicinity. So mental health, the most common place that a Black person goes for mental health is to the church, to religion. All right, they go to the pastor, so often. So we have to engage our clergy in mental health understanding and discussion, and knowing when is it time to bring a professional in, or knowing when to refer that refer what's going on to the professional. In that, I tell people, if there's a high level of impairment, they're not able to engage in their families, not able to engage in work, the need to make sure that they find a place to engage with the mental health professional when there's developing impairment. And I tell our clergy as well, a lot of people are going to church looking for an answer. Being from the community, I've discharged people at 3 o'clock in the morning and show up to church, and that person is there. And I say to myself, they look completely different when they show up to church. They were on a hospital floor, but they come looking nice, suit, tie on. I see ladies I'm like, where did you get your hair done between 3 o'clock in the morning in church today? All right. And they will come in there looking great, and they're looking from a word from the Lord to help them get through their day their week, their month, and sometimes they're looking for a word to get through the next moment. So we have to make sure we pay close attention to that. And the key, as Dr. Anderson stated, that issue of hopelessness, like there's no other way out other than death. All right. And that's how serious mental illness is. I tell people depression is the great liar. It tells you that this is the last moment. This is the last step. There is no further other. There is nothing left for me. And that is the onset of illness. And we've got to be aggressive when a person has gotten there. If you look at, say, 9/11 incident, you saw the people jumping out of buildings. You don't go and send a psychiatrist in to find out, hey, do you feel depressed? No, that person's in a feeling of a hopeless situation. All right. And that's where we want to make sure that we try to prevent people from being there. But if they are there, we've got to be aggressive and intentional. So if our son feels like there's no hope for me, there's not another life for me, there's nothing past this moment. Our men feel like there's nothing past this moment. We've got to be intentional. We maybe need another male to talk to them, their boy, their frat brother, their uncle, their father, to reach out. And I've had, I see a fair amount of Black men in my practice who say they will only see a Black male psychiatrist because they want a male, they want to talk to a male. And when I say that, it's not that a woman is not adequate. Me, myself, as a mental health professional, I actually prefer to see a woman myself. But some men want to see a Black male who can feel and understand their pain, because you know that we're coming from a similar situation. And it's important to make sure that we get them in to see someone. It can be hard to find a black psychiatrist. So we talked about Psychology Today. That is an excellent place. Do a Google search, word of mouth. You know, a mental health professional. Don't forget about the school counselor. That is somebody inside the school who specifically deals with mental health. Realize they don't have a school medical doctor. They've got a school counselor inside of that school to deal specifically with mental health issues that go on in the community.
Thank you all for your insightful questions. This concludes the question and answer segment of the program.
So I do want to mention Global Health Psychiatry. These are the ways that you can contact us. We've written 3 books. We got other books that are about to come out. We got some hot stuff coming out. I know I spoke for the Deltas a few months ago. We talked about a topic, Black mental wealth. That should be coming out this year and next year. We do education about mental health. Talking to you all is what we do. And we appreciate you all allowing us to share something with you this evening. We do training. So if people need training on mental health, your job or, your community, your church, we actually come out, we do training, and we do curriculum as well. Structured information that disseminates mental health specifically to the Black community. Realizing that we are all people who love our community. We love Black people, we love psychiatry, and we sure enough love Black psychiatry. So if we could ever be a part of whatever you're doing, please reach out to us. You can find our books on Amazon. Those are our books right there. Mind Matters, How Martin Learned to Love School Again, Bree's Journey to Joy. One thing I did want to add, in the children's books, there is a parent guide in the back. Whenever we write a children's book, we write a parent guide in the back, which actually goes more in depth into the diagnosis of how Amari learned to love school again, about ADHD and medications, things that your rights as a parent inside the school. And with Bree's Journey to Joy, we talk about childhood grief, and we talk about childhood depression, and we actually have more information than what we've talked about today about childhood suicide as well. So they're animated books with beautiful Black faces, all shades of color, and and all type of hairstyles and the things that Black people do. We want to make sure the books identify with our people and educate our people, because you can manage your mental health. So thank you all so much for allowing us to be here today. Please contact us. Let's keep the conversation going. All right. Let's talk the conversation. Take the information that you've learned today and share it with your family and your loved ones. Understanding that mental health is treatable. And most of all, the majority of it is preventable as well.
Thank you very much, Drs. Higgins, Anderson, and Salam. We have thoroughly enjoyed hearing today's presentation and the answers to questions from our audience. We also appreciate hearing the statistics around suicide rates in our community, and most importantly, the work being done to dispel the stigma of suicide. It is our hope that you continue to educate and empower our Black men domestically and globally. I want to encourage all of our attendees to apply what they have heard today and encourage friends and family to educate themselves more about the mental health challenges among our Black men. Let's also commit to providing a safe haven for our men who are currently learning how to live with mental illness and those who do not have a mental diagnosis but live with daily stressors. Again, we thank our panelists for this wealth of information. Before we hear closing remarks, we will now have a quick poll. Thank you for your participation and engagement. If there are any unanswered questions, please feel free to contact the doctors directly. We encourage everyone to follow our Facebook and Instagram social media pages to stay abreast of our projects and service activities. As a reminder, a brief survey will be shared immediately following the webinar. Please take 2 minutes to share your feedback with us. As we come to a close, please join me in welcoming Tanera Matthews back for closing remarks.
Thank you again for your participation, everyone, in today's discussion. I would like to especially thank all of our guest speakers, members of the Physical and Mental Health Subcommittee, Program Planning and Development, and the Technology team. The Suburban Houston Fort Bend Alumnae Chapter is committed to serving our community through personal development, financial literacy, health and wellness education, and scholarships. We encourage you to follow us again on social media to stay informed of upcoming events, dates, and ways you can support our programs and scholarship initiatives. This concludes today's events, and I hope everyone has a wonderful week. Thank you.